Good morning. This is the September 17th Board of Health meeting, 10 a.m. in the Norwood Town Hall. Just to let you know, this is being televised. Everyone's aware of that. There is a correction on your meeting notes. It should be September 17th, not September 11th.
I wondered where that
That's
came from.
me. That's probably the day I typed it up. I apologize for that.
That's okay. Just wanted to bring it up, just to make sure it's correct. Okay, approval of the minutes for June 19th and June 27th.
I make a motion. Oh, second.
All in favor?
Aye.
Okay. Start off with new business, or is there anything anybody wants to talk about before we do new business?
No, maybe in between and while we're doing it.
Okay. Triple E update.
So we included this morning on your tables the latest arborvirus surveillance program report, which just had a few more positive mosquito samples. There's actually the only big changes on the map on the third page is there's actually been a reduction in one area that was reduced from high and critical. Some towns were reduced out in Western Mass though. We have had no changes in our moderate risk level.
So we're still at a moderate risk level? Okay.
The aerial application to a portion of town was done over the weekend on Sunday night.
Okay.
We continue to monitor it week to week. The hope is with cooler weather that mosquito activity starts decreasing, but really we need to be vigilant until the first deep frost.
Okay.
Dengue fever.
Those are other mosquito-borne illnesses. Most of those are probably travel acquired, not locally acquired.
Oh, okay.
We caught them somewhere else, Joan.
Oh,
then they
okay, because I
travel.
saw Norfolk County and I
They
said,
travel,
dang,
yeah.
yeah, I've
That's
never
just
heard of
where
that,
the
yeah.
person lives, so
Oh.
they probably traveled somewhere.
Oh, okay, and the same with, I'm not.
Chikungunya, yeah.
Chikungunya?
Those are all imported
Yeah.
cases.
Oh, okay, so they're not anything that's indigenous to this area.
No.
Can I ask you a question?
Sure.
Scott, several people come up to me and ask me, do we govern, do we notify the schools in a way that we would make a recommendation to them to not be outside for afternoon sports and early evening sports? Several parents said, the coaches say, well, it's not high risk and we haven't got a call from the Board of Health. And I thought, okay, I'll look into that for you if you want me to, so.
Sure.
So
Well,
how do we handle that with the schools?
Yeah, we've always followed the procedure that the state has designated. There's a whole surveillance and response plan. And included in your packets is actually the characterization of each risk level. And so we are designated as moderate. Now, there are some towns that are adjacent to us that are designated at higher levels, either high or critical. And those are because they've had more mosquito activity. They've had either a positive mammal or human case, or they've had more positive mosquito pools tested for EEE. So there's reasons why each town is designated, and it's actually a very complicated calculation that determines it. So where we are at a moderate level, the procedures we're supposed to follow is really personal protection, so wearing the bug spray, avoiding areas with high mosquito activity, and if you are out, wearing long sleeves and bug spray.
Okay.
So that's sort of the response to the risk level we're at. If we were to elevate to higher
Bless
levels,
you, Johnny.
we would be talking about
Excuse me.
canceling evening activities
Yeah.
and really restricting outdoor activities in those times when this particular mosquito is most active, which is at dusk.
Okay, and the question that was brought to me also, and it's very true, and I'm sure we all, with common sense, say, okay, so this is a Walpole, that dreaded town to the north, and they have an active mosquito pool. So here's Norwood's line, why aren't we taking the precautions that they are? I mean, it's just a matter of feet that mosquito was, high alert there and not, 50 feet down. I don't, people say, I don't get it, Carolyn, why aren't we into that? How can you be so particular? I said, well, because we're doing surveys and we're pooling the mosquitoes.
Yeah.
And they said, well, why two in Walpole and Norwood's, 50 feet down the road? And
Well, if you look on the maps, you can kind of see there are zones around critical areas. So it's not like you go from a critical to a low. There's going to be a zone around it. So we, like I said, it's a complicated equation. and
okay, that's
procedures.
hard to explain.
We don't know if that positive mosquito pool was on the Norwood border.
Well, that's what
or
I'm
the
saying.
Medfield border. Now, where I see Medfield is a higher level, I would assume the positive mosquito pools are closer to that side of Walpole and not right over the border. Because obviously mosquitoes don't know town borders.
But it's
So-
just a guesstimate. It's nothing.
Well, it's a very educated guess based on a lot of data that the state and the mosquito control program collect. So it's about mosquito activity. Now there's large swamps in the other side.
Wetlands,
And-
sure.
Yeah, and that's gonna be where they're finding positive mosquito pools. We do test in Norwood. If we were to see more increase in activity or increase in EEE in our positive tests, we would elevate. They would elevate. So we really prescribe to the notion that you need to have the proper reaction to the amount of risk that exists in your community. And there's a level of trust with the state that they are calculating and taking a cautious view, and they're going to be very conservative in their views to say, yes, this town needs to go to this level and this town needs to stay. But it's not that it's a mosquito right over the border. It might be on the other side of Walpole, on the Medfield side,
Yeah.
where they're seeing the positive test. So if
But
it
that
was,
mosquito's not gonna fly over the Norwood border?
they're not going to go that far.
Okay.
They can travel what up to a
Well, I
mile
mean,
or two.
I have my concerns because this, multitude of children out, running track up at the high school fields, junior high fields, soccer fields, and it's a huge concern. And the parents, three came up to me and said, well, what's the Board of Health doing about it? I said, well, we're taking very good care of the situation. And how often do you update the schools with this?
We've been pushing a lot out on social media. We don't talk directly to the schools. We have when there was the aerial spraying, and if we were to change risk levels, of course we would have. We
You
would
talk to the
reach out
AD?
everybody. Yes.
Okay.
And we get a weekly, this is a weekly update, correct?
This report comes to us weekly, but if during the week levels can change, and we get a notification, so we also know if surrounding towns change.
We have to understand the parents' concern about that.
Oh,
yeah.
absolutely.
Yeah.
And I do
Yeah,
want to say, yes,
understand
I
it.
completely understand the parents' concerns. It is still a very rare disease. There are only 8 human cases in the state, which is much more than we've seen in past
In the
years.
past years, yeah.
But it's still only 8 across the state of Massachusetts, which
But
is a very
it
small
still
number.
sends you into the panic mode.
If you're a
like-
mother and 8 is,
Well,
Yeah,
if you're, and
numbers
if you're
don't mean
somewhat
anything when
affected
you're a
by
mother
it.
and this young.
Yeah.
Well, I told them that we're very active in how we communicate with the schools, and you obviously just reassured me of that, which I was pretty sure of, that we did that. So we can't do any more than what we're doing.
right.
Yep, so we continue to moderate the situation, and if things change, we definitely
Thank
contact
you.
not only the schools, the rec department, our town officials, town employees that are out there at dusk and dawn too,
Yeah.
DPW, I think, police and fire that might be outside at those times, so we want to make sure that they also know the risk level.
Okay. I really appreciate all that. Thank you, Kathy. Thank you, Scott.
Any other questions about EEE? Okay. CBD information.
So we've been trying to navigate the very difficult enforcement of CBD. This is an insert we're going to put with all our permit renewals, not only with food establishments, but anything that we regulate with a permit. We want to notify them of the CBD regulations. A lot of this is enforced by FDA. But they have sort of both the State Department of Agriculture and the State Department of Public Health, the Food Protection Program, have issued some statements that we can enforce on the local level. So the main thing is we want to get the word out that CBD cannot be in any food product. No
Sold
food
in Norwood.
whatsoever. And anywhere. It's an FDA regulation. CBD cannot be sold in any food product in the country.
Okay.
It is widely out there in food products. So enforcement is a big challenge here. They also cannot have any therapeutical or medical claims,
Oh,
which you also see widely out there.
Yeah.
yeah, because you hear that on the radio all the time and
Right.
the TV.
Well, that's why they sell it, for your
Wow.
medicinal
Yeah, they
purposes.
can sell, hemp seed oil, powder, hemp protein. And also what has been confusing all this is the difference really between marijuana and hemp.
Right.
Most CBD product
Hemp.
comes from hemp, which is a different plant. THC, and what we think about as traditional marijuana, comes out from the marijuana plant, and THC is a component that makes you high. So people that want to look for the medical component are looking for CBD. But understanding that those are two totally different products. Industrial hemp is used a lot. It's not a marijuana product.
In
So-
clothing?
Yeah, I mean, they make
Really?
hemp fiber clothing, industrial hemp,
A lot of your
building material.
natural products.
You go to Cambridge, you
Alright.
could buy a hemp skirt, Joni, I'll pick you up on.
Yeah.
You can.
No, but a lot of your natural products are hemp-based.
Yes.
So because it doesn't have as many allergens as
Wow.
other things have.
So when you go into a store now, that I understand, and you go to, and there's CBD by the door as you walk out, that's not regulated, or that's regulated? If it's
there's
just,
If there's CBD oil,
Yeah, or cream, or gummies,
Well,
or,
No
okay, you hit on the
gummies.
No
complicated
gummies.
part. So I put the little statement about cosmetics. We don't regulate that or enforce that under the health department, but I did want people to sort of understand that's a whole nother convoluted section of enforcing CBD. The main thing we will be interacting with the businesses in town are businesses that we already regulate. We're going to be advising them of this and advising them to remove product that is not allowed.
and the only products not allowed is any with food, right?
Anything with food or anything that has therapeutic or medical claims. So we don't go into
Now,
all
do-
the businesses in Norwood.
Do the claims have to be
No, that was my next question.
posted on the product? Or is it just something that they...
The advertisement.
The advertisement states that it's a medical claim? Or does it have to be, like, on the product itself, or in order, like, they could say, well, it's, you know, the gummies you can understand, and the,
But it says it right here, pain relief, combats anxiety, healthy
Yeah.
lifestyle, sleep, reduce, most of them do say that.
Yeah, but I think you like if they just sell a vial of hemp oil, and then the person tells you what the medical claims are. Yeah,
How is
and I
that
think that's
covered?
what you mean. I think I have no idea. That's part of the problem here. I think what we're going to be doing is our main focus would probably be food products because those are the things that we regulate on a
Right.
regular basis. I think it's a difficulty when we're talking about businesses that we don't regulate. We'll probably just share this advisory or this notice. There's not much we can do if we don't regulate the industry.
Right. I understand that there's a lot more stores that sell CBD products,
Oh,
It's,
yeah?
I feel like it's everywhere.
but I don't believe that it's THC CBD,
No.
it's just CBD.
Just CBD.
Yeah, that's what we assume. None of the product is tested, so we don't really know.
Right, that's the problem, it hasn't been all tested
Well, and
as yet.
this is much like vaping. Everybody said how safe vaping was and how good vaping was, and now all of a sudden they're realizing that vaping is terrible. It's health-wise, it's unbelievable.
I don't know where the law's gonna come in and make this easy for us.
I know,
Yeah,
it's
okay.
very difficult. So we just sort of take it step by step, like I said, mainly focusing on food products. And also, with the images on the back, things like candies particularly are things that we're going to be targeting. We don't want, it's attractive to youth.
Yeah,
So this is
drinks.
going out to all the stores.
Everything that we permit, actually.
But there's so many that we don't permit that have
That is
these.
the problem.
Yeah.
And we've actually, I got one complaint yesterday of a store that we don't permit that's carrying it. So I'll probably go in with just this notice and advise them to remove it.
Yeah.
Right.
Yeah.
Why are you gonna ask them to remove it? If it's gummies?
If it's a food product.
If it's a food
The
product,
food
what if
product.
it's a regular oil?
No,
Then they're allowed.
They're
Yeah,
allowed,
okay.
yeah.
Yeah.
Just food we're gonna handle now.
Now, this is federally that it's not allowed in foods.
FDA
So it's
said.
not just
No, it's not just
Massachusetts.
local or Massachusetts,
Okay.
right?
It's a federal.
But
Federal
on,
law.
on the gummies, it says here certified, but certified by who? By who? You know, because they don't have any certification for CBD.
Well, they might mean certified when I read into this that it does not contain any THC.
Yeah.
So when I've read a lot about this to comment, a lot of reputable companies have put chemists on this to make sure, and they say reading the labels, but the general public doesn't know that you read the labels that say this does not contain any THC. I mean, that's what we have to find out, which products they manufacture and have the THC, but sometimes they're not putting it on, that it is made with that.
Well,
Well,
it's
the point
very,
is it's not checked, it's not regulated.
Right, there's no
so
way to
nobody
do that.
knows whether those claims are correct or not.
So if you go to the register at the liquor store and say, well, does that have THC in it? What's the guy gonna say to you?
no.
No.
But like, okay, the analogy with alcohol, the
And
percent
you go home and you
alcohol is
give that
right
to
on
a
the
kid who's
container.
seizing.
Right, the percentage of THC is not listed.
And it's not tested.
Right.
It's not regulated. Alcohol is very strictly regulated where the percent of alcohol is listed right on the container and it's verified.
Yeah,
Um,
this is not,
This is
so
not.
that's probably why, until they come up with probably a firm way of testing all of these products. And every day, there's new products out there. I've never seen half of these products. So there's new products out there every single day, and I mean, there's a lot of people that use it. There's a lot of people that say they get a good benefit from the CBD oils and creams, etc.
I know parents that tell me they give it to their kids when they go to school because it calms them down.
Yeah,
Are you
but
kidding?
There's just no tested,
there's no
science-based
tested science.
evidence of
Yeah,
that.
Yeah.
Whether it is or isn't, there's no medical evidence.
No,
of
there
that.
is not.
Right.
So another whole aspect of this, which when we talk about substance use prevention, is that the confusion between marijuana and hemp and CBD and THC and the normalization of it. When we see these products everywhere in our environment, we tend to think it's less risky, and so youth are seeing a hemp and a marijuana leaf do look the same.
Yep.
They're seeing those products with those images constantly in their environment. So that's another thing we want to battle and remove. And they're seeing it in forms that are appealing to them in candy.
Or drinks even, that,
Yeah,
you
fun
know.
sodas and
Yeah.
I can't believe they could figure out how to put it in a soda.
Well,
Wow.
it's gonna make money, they'll figure a way to do it.
Ever-changing, thank
Yeah.
you, ever-changing daily.
Okay, moving on. Interface service report? Who's gonna give that?
Oh, no, this was just the report that they submit to it as part of the contract every 6 months.
Oh,
This
okay.
did
I thought that
include-
was great. They had some good information on this, on who was calling and, you know, why they were calling, and, I thought that was pretty neat, that the way that they did that.
Yeah. Just want to stress it is de-identified, so we don't know who is calling. We know some
Right.
demographics about them.
Right, and,
It's anonymous, correct?
Yes.
oh, sure, everything, yeah, is
Yeah.
anonymous, but I mean, it just, where they were calling from and how they, you know, I just thought that was really interesting. Anxiety being the top one of all of them.
And that goes back to why the parents are giving those kids that,
Yeah, I guess.
I mean, seriously.
So how long do we have this? This is a grant, correct?
We have grant funding to have a contract with Interface Referral Service for 2 years.
2
Uh-huh.
years, okay.
We are about to start the second year in November.
Okay.
So then we were, right now, the Minds Matter group is talking about what we would look for funding to continue it. A, if we want to continue it, has it been successful? And B, how are we going to fund it?
Interestingly enough, I see that the children from 6 to 12 years old, they had 16 clients, but teenagers, which you would think would be the most, they only had 6.
Mhm.
So it would just be the parents calling, and, okay. Yeah, that kind of surprised me. Just the age groups on some of the kids that were, some of the people that were calling.
And this
Yeah.
was our first 6 months
Yeah,
rolling out, so our numbers actually look pretty good for
Yeah,
communities
absolutely,
that have just
yeah.
started. We'll see in December, probably beginning of January, we'll get our second report,
Uh-huh.
which will have a year worth of data.
Okay.
So we'll see how those numbers change.
Yeah.
This is a great starting point.
It was to have, you know, almost 50 people using the service. I think that's a great start.
I do too, Joan, I think it's
Yeah.
remarkable.
I mean,
Well, it gives people an opportunity to talk to somebody
Oh my
without,
God.
without being embarrassed by it, or
right.
it gives them an opportunity to be anonymous, and they
they're not
can choose
identif-
to follow
Yeah.
what their recommendations are, or they can choose not to. So,
Yeah, so this
you know.
will help them find mental health treatment,
Yeah,
counseling.
Yeah, I mean, the suicide ones is alone, you know, I can't
well, mental
imagine.
health is
Yeah,
has a
it's a big
stigma
thing,
attached to it, and so a lot of people,
Always did.
don't want to get help when they need it
Yeah.
because they don't want anybody to talk about them or make them feel bad.
Yeah,
So this is a vital service to this.
unbelievable.
Where is
They
Williams
really did a
James
good job.
College?
It is in Newton.
It's in Newton.
Another thing I just want to point out, which I think is great, is that we do have a balance between children and older adults. And I think that's a result of our collaboration with the senior center and the schools and
Yes.
youth serving organizations, that we've really put the word out to a lot of different populations.
Right, I'd like to see more young adults take advantage of it. I see we only had 4, but I mean,
Yep, young adults and adults are always difficult for us to reach because we don't really have an avenue for them. You know, we
Right.
can target them as parents
yeah,
of if you have a child in school, but if you don't have a child in school and you're not involved with the senior center or elder services, we
Right.
really have a tough job. It's hard to reach you.
yeah.
So we have been putting it out on social media a lot, you know, but it's on Nord Community.
And plus, I
Yeah.
think that stigma piece is a huge,
Definitely, and
you know,
we do a lot of messaging to try and combat
yeah.
that. And Daryl's been really good at that on social media.
Oh, good, good, that's good.
Yeah, no, that's great. I great first 6 months.
Mhm. Thank you.
Okay, moving on, Household Hazardous Waste Day is going to be September 28th, 8 a.m. to 11 a.m. at the town landfill. It is only open 8 AM to 11 AM for the hazardous waste day. It is not open after 11 AM. We take no brush.
Yes, yes,
And,
yeah. No lawn clippings,
no
no.
lawn clippings. Those will,
nothing.
you'll have to go, it's open every other Saturday for that, so. You will be receiving the thing in the mail, correct? It already went,
Yeah, they
went out
in
with the light
in the
bills?
August light bills.
Okay.
So,
Okay, so again, hazardous waste day,
Get that,
September
Mike.
28th,
yep.
8 AM to 11 AM. And if you are in line at 11 AM, you will be allowed to go through. But we've had a lot of people last year, the last two ones, that even at 15 past 11, they were like, come on, let me in. And, you know, we have to cut it off at some point, so.
But it's not us, it's the services we paid for down
Right.
below. They have to be out,
Right.
you know?
So
They
if you-
committed to an hourly rate.
If you are in line at 11 AM, you will get taken care of.
Okay, and the permanent collections are every Saturday from 8 to 1:30, is it?
Yes.
Yeah, except the 2 Saturdays of
Except the
hazardous
2
waste.
Hazardous
Saturdays,
waste.
yeah.
Yeah.
So anybody can come there any Saturday between 8 and 1:30, so that's good. All right.
Okay, I did want to clarify something. The $5 per carload is if you have a hazardous waste, correct?
Correct.
Or is it every single car that comes through,
Just for hazardous waste.
just for hazardous waste?
So if you're just
Okay.
coming in with the TV, you just pay for that TV.
TV.
If you're coming in with TV and pesticides, you're paying $5 for the
Pesticides.
pesticides and $20 for the TV.
If you're coming in with the TV and a microwave, you're paying $30.
Right.
Yep.
Correct. Yep.
And it's posted on the town website, and people can definitely call our office if they have any questions.
Okay. And it's a good deal, because if you have to go to the town and you get one of those stickers and leave it out in front of your house, it's gonna cost you more money to
It's
get the sticker.
$25
It's $25
per
for a sticker.
item.
Per item, right.
Is it?
Yep. So, okay.
Any other issues with hazardous waste? No?
No?
Okay, moving right along. Public flu clinic, October 19th, 9 AM to 11 AM, and that's at the senior center, as in the past. Okay, and that's from ages
Open to ages 14 and older.
14 and older. Okay.
Is there anything else going on that day? Sometimes we have a dental clinic.
Yeah, in the past, we've partnered with the dental clinic, not this year.
Okay,
Not this year.
thank you.
And do we know what the strength is of the flu product?
I don't think anybody knows yet.
Okay,
But, you know, we hope there was a slight little delay because they wanted to make sure they got it right, but nothing that's going to affect our distribution of it.
okay.
But, you know, the hope is it's a good match. But we still always tell people the best way to avoid getting the flu is to get the flu shot. Even if the match isn't great, it still does protect you.
And it is a dead virus, and you can't get sick from it. And-
Is it the quadrivalent?
Yes,
It is the quadrivalent, okay.
which means it protects against 4 different strains.
Okay.
Okay. Any other questions about the flu clinic? Again, the flu clinic is at the senior center on October 19th from 9 AM to 11 AM. So please come and keep us busy for those 2 hours to get your flu shots.
And no whining and no crying.
Wear a sleeveless shirt if you can. It does
Yeah.
make it a lot easier.
Yeah. Yeah, no turtlenecks.
All right, moving on. Old business. Nurses report.
Hi, Angela. Hi, say hi to you. Very well. How are you doing?
So, okay, I can't find my nurses. Oh, here it is. Okay. So, anybody have any questions or concerns
Yeah,
about
what's
that?
ehrlichiosis?
So it's a tick-borne illness.
Okay.
It's caused by the black-legged tick. And it causes disease, symptoms similar to Lyme disease. There's several that are reportable, and that have been reported in this area. There's babesiosis, which is caused by a parasite. There's anaplasmosis, which is a bacterial infection caused by the same black-legged tick. There's another one, Borrelia miyamotoi.
Yeah, that's what I'm reading. I don't ever remember seeing all these lovely things on the report before, and I just
Well, they're
thought,
doing
whoa.
more testing. I was speaking to a physician in Boston who was telling me that she is doing a lot of testing, and she's including Borrelia in that testing.
Because that's it, Lyme disease as well?
It's
Yes,
a
yes,
normal-
but they'll sometimes do they'll test for a number of ticks to determine if the particular tick that the person, caused several diseases, which is always possible.
Wow,
But,
so,
many of them are treated with doxycycline. The Babesia is caused by parasites, so that's treated with a different medication, an anti-parasitic medication.
yeah, it's interesting to see all of these things and hear about that little girl that just died from swimming in a river that was
An
close to
amoeba.
her house. Yeah, the amoeba. It's almost like you want to put a bubble around yourself and not go out in the woods type of thing, but,
Well, the most important thing is prevention. So,
Right.
It's not a good idea to be walking in the woods without protection, without long clothing, without deep.
deep.
Bug spray.
And you want to stay on the paths. You don't want to stray into the woods, into the leaf litter and the moist areas. It's just important.
And Karen, these diseases that that you put numbers beside, these are ones that we know of that have contacted their doctors and their doctors have contacted us? Or the state contacts
So
us?
the state notifies us through an electronic
So not all
reporting system.
patients that contract Lyme, could be on here, right? It could be more, could be,
Well, if they're tested and they come up positive for it, we will be notified.
their
because it's an
address
automatic reporting system.
automatically sends us a notice.
But people may have it and not be tested, and then we don't know about it.
Okay,
So-
yeah, I figured that.
And there is a suspicion that there's more than we know about.
Yeah. Lyme disease has a lot of symptoms that are similar to just the everyday general ill health. You can
Yeah, I
have
mean,
a
so
high
many-
fever, you can
Achy
have
flu,
achy-
yes.
achiness, so, I mean, you can have some joint swelling and, so a lot of people don't want to, and they haven't found a tick, so they don't think that they have necessarily Lyme disease, but
And
it
the
is.
ticks are so tiny that
Yeah,
you can't assume
yeah.
that you will see it
Mhm.
necessarily, but it's very important to do a tick check.
Yeah.
Well, look at this
Um,
Lyme
they-
disease suspect, 22.
So, right, exactly, yeah. It's about the same as last year at this point in time. We've had about 35 cases to date reported to us since January of this year. It was similar last year.
Thank you, Karen.
Yeah, thank you. Anything else, anybody?
No, that's crazy.
No, we're providing guidance and resource information to Walpole.
They have a new public health nurse.
Uh-huh.
So they contacted Sagala and requested that she spend some time with me, so.
Oh, good. So maybe we can get her for the flu day? I mean, seeing as we're volunteering for her, she might volunteer for
It's
us.
possible, I hadn't thought about it.
We actually had a very nice trade. We had a septic system application, which we don't have very often in Norwood. So I was a little out of practice, so actually I traded with their assistant director to get our septic system reviewed, the plan reviewed, and then we took their nurse. But and I'm joking that it doesn't have to be an even trade.
Yeah.
In communities, we tend to do that to
That's a great
cross-train
thing,
each
though.
other.
Yeah, that is.
Do they offer a flu clinic in Walpole as of yet?
I think they
In
do.
the past, I think they had utilized pharmacies, but now that they have their own nurse, I believe that that's what they were planning to do. So whether they will get it up and running for this year, I'm not sure, but it was their
Good.
I was interested to see that we had over 600 children for the camps. Wow.
I
That's-
know.
That seems like a very large number
very
of kids
similar.
for the
Look back
camp.
at last year, and we had a similar number last
Yeah.
year, but it's the summer is busy.
Yep.
Good.
All right, good. Thank you, Karen.
You're welcome.
Great
Thank you,
report.
Karen.
Drug-Free Communities Grant Program and Impact Norwood. Good morning. Had a busy summer.
Oh, yes, we had a very busy summer. So we have 3 big projects going on right now. 4, but it's over Norwood Day. We brought in the mega lungs. If you remember last year, we brought in the mega inflatable brain. But this year we brought in the lungs just because of all the stuff around vaping. It was really cool. It talked about different lung conditions. You could learn about emphysema, asthma, bronchitis, and the effects that vaping or inhaling nicotine can have on your lungs. So it was pretty cool. A lot of kids thought it was a bouncy house and were just jumping up and down on the ground, but they had fun. So that was good.
Is this something that we could bring up to the high school for the kids?
Possibly next year we could try and, it's quite expensive, so we would want to try and tack it on to Norwood Day if we do it again. It didn't work out this year to bring it up for a few extra days, but it's something we could explore for next year, definitely.
Okay.
And I would even say the middle school.
Yeah, I
as
was just
well.
gonna say
Yeah.
probably the middle school, get them before they get up to the high school.
Yeah, yep. So that was a success. Over the summer, we also put together a youth ambassador program, which was kind of building off of the youth coalition that we had last year. So since we had that momentum, we really put together a comprehensive program. So it's an after-school program for youth in grades 6 through 12. We meet weekly at the high school, and they'll learn public health and prevention skills, and we'll work on some of those projects, but they'll also learn life skills. So we're using people from the community. Our new HR director is going to come in one day and help youth build resumes or give them tips and tricks. We're going to have someone come in and help with public speaking skills, interview skills. So it's a really great program that I hope will build some leadership and advocacy skills for youth in the community.
And if there are any people in the community that might be interested in talking at this group, who would they contact?
They can contact me.
Okay.
Yeah, they can go to the Impact Norwood website, impactnorwood.org, and then the Youth Ambassador page. There's a form at the bottom. Anybody who has questions about the program can email me through that form.
And is this a program that's just during the school year, or is it going
I
to?
hope we can try and run a few meetings over the summer so there isn't a lag or like a stop.
Okay.
Obviously, it's easier to get youth during the school year
School
because
year,
they're in
yeah,
school.
yeah.
But if we continue this momentum, I'm hoping some of them, if they're around, are willing to meet over the summer so things don't come to a stop.
And how's the response been from the students?
Really
You
great.
have a lot
Yeah,
of-
we had our first meeting this past Friday, and we
Okay.
had about 15 or 16 students.
Oh, good.
15, I think. So, yeah, it was great. Some returning from last year, some new ones, and we actually had 2 middle school students there, which was really
Oh,
that's
exciting.
nice.
good.
Yeah, so I hope that they tell their friends about it, and hopefully more will come.
Do you think that's something that you might broaden out towards the middle school, or you're gonna just keep it at the high school level for now?
So we're inviting youth from the middle school to come to the high school for the meetings,
Okay.
and providing transportation for them, if they need it. So, yeah, anybody from the middle school is welcome to come up to the high school for the meetings, and we're working with students on a case-by-case basis if they need transportation.
So, do we see any success rates from this yet? Have we, you put all this effort in, and the town puts this effort in with you, your leadership, to gear these children to the right direction. Have we seen any results that we've helped?
I think because it's so soon,
It's too soon.
we haven't collected any data to see
That's what I'm
the
interested in. If
change has
somebody came
been.
back and said, I used this service, I'm now drug-free. I'd like to see, how this ends up for some kids.
Yeah, and we're hoping that once we do if you remember, this past October, we implemented the Metro West Youth Health Survey.
Yeah.
We're hoping when we implement that again in 2020, we'll see some of those substance use rates decrease, and those would hopefully be as a result of this peer leadership program and the work that they're doing or those that are involved in it. So
Is this the only reportable way? I mean, is this the only reportable piece that we have?
the Metro West Health
Yeah.
Survey. No, we have that, and we look at a lot of other data as well. We do focus groups and interviews with individuals. We can look at school record data, police data, hospital data. We have a whole slew of ways that we collect this information.
Okay.
So the police can get to you, any guidance counselor can get to you, and any nurse within the school system can get to you. So that's kind of a feeder program for
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 the Youth
kids-
Ambassador Program?
Yeah, no, not for that particularly, Aubrey, just for any child or youth that may want to access any of these services that they think a student might need.
So we So, are you talking like treatment?
Yeah,
Or-
like so that you can then take the next step and say, okay, we don't treat, but you do a little research for them and say, okay, here is a program. Do we do that for the schools or no?
Not really.
Okay.
I think because my expertise isn't in treatment and I don't know what would work for a student. and
Right,
what
okay,
wouldn't
good point,
work,
yeah.
But we can also refer them to the interface
That's fine.
service grant.
Yes, yeah.
So I focus more on the prevention piece and trying to help students before.
Yeah, so
they
I just
get
like to
that
see it a
point.
full circle.
Yeah.
That, you know, we're doing this part, so this part and that part's gonna complete, and then a student or person in the town can get a complete service available. That's great. Thank you. Thank you. We are a good
Two.
service.
Two other big things. Coming up this Saturday, we're hosting, along with Progress Norwood and Norwood Youth Soccer, an inaugural World Cup and cultural celebration. I think it's going to be a really fun day, despite me freaking out that it's not going to turn out the way I hope it will. But I think it's going to be great. We're going to have a soccer tournament going on one set of fields at the Coakley, and then down below, Progress Norwood has put together some really great family fun activities. There's going to be a musical instrument petting zoo with instruments from around the world.
Oh, wow.
They found some volunteers that are going to come in and share traditional dances from their country, so I think it will be really fun. And then long games, and food will be sold from the snack shack that's there. So looking forward to that. People want to
The hours, Aubrey.
3 p.m. to 7 p.m. at the Coakley.
Ooh,
Dusk.
okay, dusk.
A lot of bug spray.
Okay.
A lot of bug
Don't
A lot
worry.
of bug spray, okay.
Now, see, immediately we went, gonna cross that off.
And then people can find more information at impactnorwood.org. And then lastly, we've been working with administration at the high school to come up with a series of workshops for students to attend after school, identifying different things like stress and anxiety. So we have our first workshop starting on October 23rd. It will be an 8-week after-school program every Wednesday, we're hoping. That will help students identify when they're feeling stressed, what those triggers were, and then give them tangible tools that they can use to reduce that stress.
what are the tangible tools?
Like breathing techniques,
Okay.
Yoga
imagery,
exercises,
yeah. So we have a professional coming in that will be doing that with them that has a curriculum.
That's
So,
wonderful.
Good.
yeah, really exciting. So-
And this is something that they sign up for through you or through the school?
They're gonna
or
be signing up through the school.
Through the school.
Yeah, so we're working on publicizing that.
Good.
That's
Nice.
it.
Yeah,
I've never heard of the word anxiety when I went to school, or when my boys went to school. It's just everywhere now in the school system. I mean, it's just a huge part of what the kids' MO is. I mean,
Yeah, well, we're hoping this program can help.
I hope so.
Yeah.
Thank you.
thank
That's
you.
it.
Okay,
Thank
Thank
you,
you,
Aubrey,
Aubrey.
thank you. All right, so, on to Joan's favorite part,
Yes.
Nice job, yeah.
the food safety reports. What we're gonna try and do, because there's so many pages since we've been gone for the summer.
Right.
is, maybe if Angelo can tell us ones that he really thinks and then that are high
Critical.
need, critical for us, and then any that we have, we can maybe talk
They're
about.
probably the same ones
They
that
probably are.
Angelo has, because
Yeah.
just from reading the report, yeah, the reports, I was impressed. They look like, some of them look like a book form,
Yeah.
but they were good.
So do you wanna do your update first?
Sure.
And then we'll do
Do the update? Sure. Boston Market, they sent the alternate person in charge to attend a food manager certification course on the 9th. It takes about 10 days for the results to get back.
Okay,
So I will follow up with them in regards to hopefully her passing the exam and becoming the PM alternate person in charge
Okay.
of the establishment. So
So we're gonna keep them on the
we'll
list.
keep on the list.
Yep.
okay.
See, the next establishment there is IHOP. I reviewed their most recent pest control reports. Show no pest activity in the establishment, no evidence, no catches or anything like that. So, and they continue to be treated monthly as well.
Okay,
So we
good.
can take them off the list.
You can take them off?
Yes.
Okay, so we'll take the IHOP off the list.
Children of America, they had cabinets that were in disrepair in the kitchen. They were repaired. Photos were sent to me, which I did attach to the reinspection report. so we can take them off the
You
list
could
as
take
well.
them off as well? Okay.
The next establishment here is Convenience Food Mart. They did contract with the pest control operator. They are being serviced monthly by the PCO.
What address is this?
This
Joe?
is
Please.
next to Mina's Cafe.
Oh,
The
in
plaza?
South
Yes.
Norwood?
Thank you.
I
Okay.
would like to suggest that they do it more than once a month if they still have activity.
The only activity they had is in the ceiling, in the bait boxes.
Uh-huh.
There were no food invasion or catches, but what I can do is I can ask for copies of their most recent pest control reports.
Yeah,
And
it
review them
just
before the
seems
next
like a
meeting.
matter of time before they'll
Sure.
get down
Yeah,
into the
absolutely.
food. Yeah,
And this
I'd
was-
like to see that. I don't know about anybody else, but
Okay.
I'd like to see them do
So I
that.
should be able to review August and September before
Yeah.
the next meeting. That's fine.
Okay.
Okay.
Okay. Sure.
Do you think they need to stay on the list, or can we take them off, or you just want to keep them on until you review those?
Yeah, I can keep them on until I review the
Okay.
reports.
Yeah.
Yeah, that's fine. We'll keep them on.
Okay. And then on to new food establishments.
Okay. Hampton Inn, there was a change of ownership there. So everything stayed the same,
Okay.
just a change in ownership. And then Norwood Center Pizza and Grill was the Old Sokos
Oh, that's what it's
on
gonna be
Washington.
called. Okay.
Oh,
So the new owners, they've been permitted
Okay.
as well. And
you're open and running?
correct.
Okay.
Yes. And the rest of the establishments on that list are pending. So,
Okay.
Do we have an update on any of them, Angelos? Like Daddy's Dairy, everybody's asking.
So Daddy's Dairy is, they're still in the construction phase.
Yeah, I didn't see it yet.
So I did a walkthrough last week of the establishment. They were more than halfway there.
Halfway.
So there's some plumbing issues that I talked to the plumbing inspector about yesterday,
Okay.
so.
And the Chiffin and Eaton Cakery, whatever.
Still building out.
What's that mean? Still working inside?
They're still constructing inside.
Okay, so
Yeah.
nobody's exited the area. That's
Nope, they're
No,
still there.
Okay.
yeah.
And there's something's going into Delish? What we previously Delish?
Yes.
Okay.
I sent, the new establishment name is Manosalvas. So I sent them a letter of conditional approval 2 weeks ago.
what kind of food is that? No,
I believe Mediterranean is their specialty.
Kebabs,
so-
somebody said?
Yes, chicken kebabs.
Yeah.
So,
My understanding Daddy's Dairy might be around October sometime this week.
Okay.
I know they went before the Board of Selectmen for their CV license, but it was conditional upon our approval, so
they were aiming for October 1st. I'm not sure.
I'm not
if
sure
that's gonna
either.
happen.
I saw them working there.
Speaking of that, what about Spot?
Spot, I did send them a letter of conditional approval, but their date, they're expecting to be open in March at the new
Wow.
location.
That far away?
Yeah, they haven't
huh?
really started much construction in there. They've demoed
Yeah.
a lot of it, but they haven't
That's a
started,
big
so-
space.
It
Yeah.
is. Huge space.
Good.
So the statement, the current location's gonna stay open until they,
Correct. Yes.
Well, in this Middlesex Integrative Medicine,
Oh, yeah, that,
It's the medical marijuana.
Here it
facility.
is.
Yeah.
They've been on our list. We
for
question whether they're
forever.
ever gonna open.
Oh, yeah.
okay,
Yeah.
so the permit's still out there,
We have not issued a permit, we have a conditional approval letter.
Yeah.
a
Right.
conditional approval. Is that the
Yeah.
first step?
Mhm.
Okay,
We
thank
don't
you.
permit them till they're ready to open.
Okay,
Now, what about
Same
this
with
place?
Grassroots.
thank you.
I'm sorry.
Yeah, they've been on, I wanna say, over a year.
Yes.
Years.
Years, yeah,
I
a
think
couple
we
of
should talk
years.
about taking them off.
Yeah.
Yeah,
And I don't know if you guys remember, when we redid our plan review process, we did put a 6-month limit on the approval.
6 months.
Yeah.
So things can't sit like this anymore. If they go beyond the 6 months and there's been no contact like these two establishments.
review
Yeah.
it, take it off.
It takes
Yeah,
off
I
lists
agree.
and they have to go through the process again. Because things might change.
yeah.
It's just we can't hold them out for years.
Right.
I'm just wondering if Middlesex Integrative, that was a medical marijuana facility only. I'm
It
wondering.
was.
Yeah,
It was.
yeah. I'm wondering if with all these other marijuana facilities opening up, if they've just decided not to go forward with it. Because if you don't need to have, if you can go and buy it, why would you necessarily have to get a medical permit for it? Although I think the medical marijuana is a different strength than than the regular that you buy, so,
And most stores want to do both.
yeah.
Do they take insurance? Medical marijuana?
No, no, I don't
No.
think so.
What about the drugstore that opened up down at, where Murph, that little plaza that Murph's is in? There's a drugstore that, I just saw a
Like a
sign in the
pharmacy?
window.
Mm-hmm.
Really?
They had called us. They're a strict pharmacy. There's no food. They're not doing food products. They're
Okay,
just doing pharmacy. They had called that they'd spoken to us and to building.
okay, so it's not a walk-in pharmacy type of place, though? I understand they're just filling prescriptions and mailing them out, or?
All I
sending
know
them?
is that it's just prescriptions. When they had called, they asked if they need anything from us, and since there was no food products or anything like that, I didn't go divulge into it further.
Okay. Yeah. That was interesting that they didn't need any permits type of thing.
Well, not from us.
Yeah.
Yeah.
Not from the health department.
Yeah. They would just need it from,
There's a state license they need.
Okay.
And obviously their pharmacy license.
okay. All right. Interesting.
Uh-huh.
All right. Food establishment report, June 12th to September 6th. So is there anybody on this list besides what we think that you think needs to go on our list?
Okay. let's
Angela?
see
I like the way
here.
you said
Like
that.
Waypoint?
Wait, where are we?
Don't know what that is.
No, I think they were fine, Waypoint. I can call them about sanitizer test kits
Mhm.
and make sure they've purchased them.
Right.
But what they do is they buy pre-concentrated spray bottles that come in pre-concentrated, obviously. So I tested with my test kit, it was fine. And those bottles will not deplete for a while. But I
Okay.
can make a phone call and make sure that they've
Now, where
purchased
is
them.
Waypoint?
That is on,
Providence Highway? 1400?
yes, 1400, right before Wendy's, I believe.
Oh, okay.
Is it a cafeteria?
No, they're food brokers.
Oh, okay.
They have a test kitchen in there, which is used maybe once a month.
Oh,
They have a couple of freezers and a cooler there, so.
okay.
Cafe Fresh Bagel, September 9th, they were gonna attend the, certificate?
Yes, I did
they-
receive, yes.
Okay.
Cafe Fresh
Okay.
Bagel did submit all those documents that were requested during the inspection. And she emailed them to
I
me.
don't have any on the back of mine. You do.
Because I printed it that way.
Cafe Venice, did we do an inspection there, or just,
No, that was just a lack of
Shenanigans?
judgment,
Yeah.
yes, yes.
okay,
Oh, at the Venice?
yeah.
Yes.
Yeah. Sounds like
Very
they-
serious when we have
Yeah.
to call in all these.
Yeah. Oh, on page 4, the top one,
Yes, page 4. Is it Buffalo Brothers?
yeah.
For the water
The
main
warning.
break?
Oh, that was
Break.
me. So, it was,
Whoops, over here now.
We having trouble
it was
spelling?
not there. Are you correcting my spelling? I thought you wanted to know about the water break.
No, no,
Water
she's
break.
okay.
The water break, no. We have a water break, B-R-A-K-E, okay.
Whoa.
I wanted to talk about the water main break. It was really exciting.
So we did have a water main break.
We
Yeah,
did.
Just that
Okay.
Rama Plaza was turned off for 2 days, for a couple hours, over 2 days.
Okay.
Thank you, Seagal.
Holler if you come
Don't
up.
make a
That will.
spelling error.
Will the
Oh, no,
restaurant
there's
shut
another
down?
one in here too.
Yes, I had to shut them down.
You had to shut them down. I love it.
Oh, Stacy just pointed out another typo.
Yeah,
Spelling's
there
not
is,
my
there's
forte.
two, there's two in the.
Not mine, that's why I can never pick them up.
Yeah, well, that's later on, I'll let you know. Cedars Market,
Yes. so
I
see-
think they should go on the list.
Sure, yeah, definitely. I put on,
Yeah.
put on the update list, so we'll put
Okay.
them on the list. They are correct, they make a good faith effort to correct any items from the previous inspection. There's some follow-up items that I still need to, we're in touch and we're communicating about. So we'll put them on the update list and I'll have an update for the board during the next meeting.
And when will you go again to Cedars?
He's supposed to submit me a new pest control service contract. He wants to go with somebody else. He's not really satisfied with the current company. However, the current company is still servicing the facility weekly
Okay.
until the changeover.
He's complying to what you're recommending.
Correct.
Recommending.
Yes.
Okay.
So he said that the new pest control company he was going with, the owner was on vacation for several weeks, and he couldn't submit a contract. So I've been in touch with him, and he's gonna submit me a contract.
Who did you speak with? Did you speak with him?
Was Aziz.
Aziz?
Yes.
Thank you.
But you know what bothers me about this whole situation is every time we come down and we, they're really good for a while we're on their back, and then all of a sudden we let them do their own thing. Now we're back again, and now they're back to supposedly hiring somebody to take care of their cleaning and stuff like that. It's frustrating. They just don't seem to be able to keep it up. You know what I'm saying, is that,
The
was it
maintenance,
2 years
Jody.
ago, they had a woman in there that was supposedly gonna do all these grand things, and now she's gone, and now he's looking for somebody else to do the.
No, he actually has an in-house person who will do the cleaning of those areas that were noted on the previous report.
That's somebody new, though. I mean, it's.
Well, unfortunately, there's turnover
Yeah.
in the food
But when
establishments.
somebody, guess what I'm trying to get at is when that person leaves, he doesn't replace that person until we come in and tell him that that the place is really dirty again and needs to be updated again. How do we get him so that he understands that when that person leaves, he's got to hire somebody else and not wait for us to come in and say, look, this place
Well,
needs to be redone
Or
again.
just
Isn't-
designate somebody
I-
else.
Yeah.
Yeah, I think, isn't that what they just, because with the admin hearing, they did tell him to designate somebody.
all the
So
time.
that's part of his work order per se,
Okay.
from the administrative hearing, that he has to designate somebody, so.
But we've done this before, Kathy, that last time he promised that he would get somebody, blah, blah, blah.
Yeah.
Okay, all right.
How were they at the administrative hearing? I mean, I know that they're usually pretty,
Was
Yeah,
it
I
as
mean,
easy?
They're always cooperative and want to address it, but I think, kind of building on what Joan was saying, we've been down this road before.
Oh, yeah.
It's something that they need to maintain more consistently. But there's also a reason why Angela goes in and inspects these restaurants on a regular basis, because we want to make sure that level of sanitation is reached everywhere. So,
have
You know.
they been fined in the past?
Haven't they?
yeah. I'm pretty
Not,
sure.
not,
I'm
not,
sure
not
for
a
what
lot.
particular-
Not a lot, but
Yeah, I mean, I just feel like they're yesing us to death.
Well, and that's what Angela and I work on, to make sure there's actual things being corrected, and they're not just saying they're going to correct it, that there's follow through, there's documentation, and then Angela goes and does re-inspections to make sure what they said they're going to do, they did.
But it takes so much of his time and so much of his energy to keep up with that one restaurant. It's not fair to the other restaurants. It just, I mean, I don't know what we have to do to get them to maintain, certainly it's not gonna be coming before the board and, yelling at them, but
Well, can we find them if we so
it
find that
hasn't worked
they are
so far
not?
to do, yeah, I don't.
we can, sure, but I honestly don't.
You don't
You're
think
not
it'll
there
make
yet.
a difference, and they're not there yet.
You're not there yet. You're not there yet.
Right.
Okay.
We
That's
usually
important
find
to know.
repeat critical violations.
Repeat critical violations.
So if
And
it's
so
a
he
different
doesn't
violation every
have
time.
Different,
Right.
yeah,
It's different. It's different critical
every
violations.
time,
Yes.
right.
You certainly do all this to a point where we couldn't do it. So that's why we look for you for recommendations. If you say you can manage it right now, I mean, put them on the list.
Mm-hmm.
But once you tell us, I need help, I need the board to step in,
Yeah,
we're there to
Yeah.
back you up.
And maybe during the next inspection, if I have to go back for another re-inspection, that may be the
Okay,
time where we get come
okay.
in.
But I think we have
Yeah.
to lie somewhere,
Yeah.
the board, with what,
Yeah, I
Angela
know, he
has to
does
say,
he
correct?
does the inspections, and so that's why I rely on him to tell us.
me too.
Most importantly, who we really need to stick through our guns with and
Yeah.
really,
So what are we gonna do? Leave them, put them on the list?
They're on the update
Yeah.
list. I just need some paperwork from them.
Okay, thank you.
That's really what I need from them. So I'll update the board during the next
Okay.
meeting for that.
So we'll look at it next month again,
Yeah.
as you're
Yeah.
saying. Okay, thank you,
No
Angela.
problem.
Is that okay, Joni, with you, that he's staying?
Yeah.
we'll keep him on the list for a little bit and.
Yeah, I just hate to see Angela spending so much time with them.
Yeah.
It's just not fair to him. Okay.
I mean, they have a very good business there, but I don't understand why they can't maintain it clean. I mean, hate to see them lose their customers because they can't keep it clean. All right, anyone else that of major
I was okay with
importance?
that one.
Page 7 on Pizza Palace. Well, it's Pizza Palac.
No problem.
They're missing
Pizza
it.
Palace.
Well, that was corrected on site. There's no paper towels at the hand sink in the women's room. So, I believe it was given a verbal warning. So what I do is I take the most previous 2 or 3 inspections with me for each establishment, like Jeff prints them out for me, So when I go in next time, I'll have that information with me.
Okay.
So if that's another repeat, if that's gonna be a repeat, that's gonna be a fine.
Fine.
Okay, yes.
Okay,
So I always refer to the previous, my previous notes.
okay.
So that's how I know if it's a repeat violation or not.
Okay. My concern was the open door, the back door.
Yeah, that's a
open
first.
Without a screen.
Yeah, but that was a first for me there. He said the delivery driver must have left it open. So, yeah, I was corrected on site, but that's not something I've seen there before.
Okay.
I'll be honest. So,
I have a question about Melissa's catering. What is going on with that? Is
She
that-
has officially closed her business.
yes.
Oh, she has.
Yes.
There was a lot of back and forth. I've seen kind of 2 locations on the report, but
Right.
she's officially gave notice that she gave back her permit.
Yes,
Not-
she's no longer operating in Norwood.
No longer
No
operating?
longer has a commissary or
Okay.
kitchen in Norwood.
All right, good.
In Norwood.
Correct.
When you say okay, restrooms okay, general sanitation okay, is that?
That means compliant.
Okay,
Yeah, that's what- yeah, that's-
Not great,
okay to
but
my
it's
husband, like the
compliant.
kids play
Compliant.
okay in their sports, it's like, they could have done better, it's
Yeah,
not
I-
the greatest, but okay for you is compliant.
Correct.
Thank you, Angel.
Yes.
Okay.
Trying to save some space on.
I just like, no, that's okay, I just needed to know that.
I just was a little concerned with her that she was trying to work in areas without any,
Oversight.
From-
yeah.
Yeah,
from us.
that's-
You know, that's what I got from reading this, that she was
Yeah,
kind of going through the back door. I'm like, what's this all about?
Well, when I arrived there, she was breaking down for the day, so I didn't get to see much action in there. So I gave her a warning that if I came back with another complaint and she was still there, she was gonna get fined.
Okay,
So, and then she had called us
and said she
and
was out
said
of
she's
no longer
she's
in
no longer
business.
operating, no longer has a commissary at the Elks and all that. So,
Okay, well, that's.
and that was
good to know.
confirmed through the Elks as well. She's
Yeah.
no longer there.
Good.
Okay.
Just don't want people to think that they can just
I agree. Yeah.
Hook up
willy-nilly
shop.
open
Yep.
shop whenever they feel like it.
Yeah, what page are we on?
What page?
Page
9,
nine.
8, 9, yes. 9. Yep.
That was on 11, but that's,
All right. Yeah, the bottom one.
So for once,
Mm-hmm.
which one are you looking at? The paper towels?
Yeah, the mice activity.
Yep, the pest control operators servicing the facility weekly. There were a couple areas with a couple of droppings, but it wasn't a sign of an infestation, nothing like that.
Oh,
So they
good.
cleaned the droppings while I was there. And I had them contact the pest control operator to add more glue boards in the area for traps. So,
Thank you.
And the fly tape?
fly tape was removed while I was there. They're not supposed to have fly tape over any equipment
Product.
during
Right.
operating hours. So they discontinued using fly tape.
How are the flies getting in, though? I mean, are they opening the doors?
They have the ice cream
without the-
window.
Oh,
Up and down.
okay,
Up and down.
Yeah.
So
Okay.
when there's no customers, obviously they close it with the screen.
Okay.
When the customer's there, they order the ice cream, the payment, the ice cream being exchanged.
pesky flies.
Yeah.
They're gross. I can't with it. Completely agree.
okay.
All right, let's see.
The only other one I was concerned
Yeah, let's
about
see.
was Bertucci's with the cyclos. I mean, that was the mask he pierced,
What page
right?
you
Yeah, it
on?
was part of a larger master
Uh,
outbreak.
Yes.
I'm on page 11.
Well, I know this was back further, I missed it, but it was way back. But they had a cyclospora outbreak? Did they in particular?
No, right,
No.
it was a
Correct. There were 12 Bertucci's in the state that were affected, and they had 24 cases at the
Okay.
time
Okay,
when I was notified. And I don't believe Norwood was
one of
one of them.
Okay,
I have to confirm that though. But I did do the inspection there. The state contacted me to go do the inspection. So they sent me information they needed from my inspection.
Okay.
And I sent them the documents to them that they requested from me
Okay.
as well. So, it's right here. Here we go.
on page
What
3,
page?
yeah, page 3.
Page 3?
So do we need to maybe follow up with them once, just to make sure that they haven't, or do you think this is something the state will the state will follow through, I'm sure, because of it being so many stores that
Correct.
were
Some of the
affected.
state, yeah, that was the last I heard from the state
Okay,
and from Bertucci's.
That was back in June.
Yeah.
Correct, yeah.
so I would assume if something had happened, they would have been notifying you
Right,
before
and as of
then.
September 9th, no new information was
Okay,
reported regarding the outbreak.
okay, that's fine. I'm good with that. Okay. That's all I have. Anyone else?
I'm still
Oh,
looking
no,
just to make sure.
we're back to Melissa's Catering, go through the pain.
Page was that, John? 11?
Another
Yeah.
spelling error?
That one was mine.
Let's
Oh,
see.
she's coming off the list. It's-
Yeah, right,
It's
at the
coming
end
on
of
the
the-
list
right.
anyway, so it doesn't matter.
Okay.
It was the second to last,
Second one.
yeah, the end of the sentence at the edge.
It should be
Oh,
planned, the
plan
plan
It
review
was like
process.
pain
process.
review, and I
Okay,
said,
yeah,
yeah,
that's
that was
fine.
painful.
That was me.
Okay,
Freudian slip.
yeah, exactly.
Page 17, Angelo?
Yes.
The last
Oh.
vendor, has that been taken care of?
Are we skipping all over the place, or we going page by page?
I was skipping,
No, I was
I
trying
never
not to
got
go
one.
page
Trying
by
to go through
page
it.
by page, because it's 20 pages.
Yeah.
Which
Okay.
establishment, Carol?
The last one on page 17.
Oh, yes.
All set?
All set.
Thank
Yes. That will be checked at the next inspection.
Okay.
Yes.
All right, Amina's Cafe, did they have enough hot water, even though they're back on page 12, did they have enough hot water?
Let's see here.
Oh, don't even hot water.
Oh, they did, no, yes, that was an old water heater.
It was an old water?
Yes, I had a new one installed a week or two before,
Okay.
but the old one was like, I'm just laying on the ground in the back, so I just don't remove it.
Okay.
It's just, yeah.
Okay, and Mug and Muffin, they were gonna have some stuff installed by the end of August, was that done?
Yes, so I'm
Okay.
going to reach out to the owner,
Okay.
David, and do a walkthrough once all the new equipment's been installed.
Okay.
So I'll do that, so.
And the Norwood Center on page 14, Norwood Center Pizza and Grill,
It's the new establishment.
Yes.
Which one,
So-
Joni, are you on?
Page
Page
14?
page
14.
14.
Oh, she skipped.
Let's see here. Yeah, so I called them yesterday to get an update on the food manager certification. They were it was expired,
Mm-hmm.
so I've yet to hear from him. So once I do, I will update it on the inspection report for the next meeting.
Okay, okay.
So I will be in touch with them this week. All right,
So the Elk, somebody has checked that Melissa's still not there, right?
Yes, I did the inspection, actually. Her items were all gone.
Okay.
So I did confirm with Brian, who runs
Okay.
the Elks there, that she's no longer there.
Who do you work with when you go there, Brian?
Brian?
The custodian?
No, Brian,
Brian Fagan.
thank you, yes. Yep.
Yes, okay.
Okay. It was actually a pleasure to work with, by the way.
Yes, he is.
He's
He's
very-
done a
very
great job
smart,
with the
yeah, he's
facility.
knowledgeable, yeah, he does.
Food and everything,
Mhm.
isn't he? Yeah.
Yes,
It's a
yeah.
nice compliment.
Okay, the Waters Christian, I'm on page 19 now, I'm hurrying right along. Kathy.
19.
Yeah,
Go, Mrs. J.
Nice try.
so, yeah. Waters Christian?
Yes, he sent me, a service order that he purchased them, and he sent me a picture of them as well.
Okay.
So, yes,
Okay.
that was John there,
Okay.
he emailed me.
Okay. And Wendy's the girl with the attitude?
Yes, that was,
Okay.
yeah.
I wonder if she still works for them.
Did I believe she used her fan to take the, yes, I do
She,
believe that.
she told me that was her, she admitted, she said she did not do that, she used a scoop to remove the ice,
Ah,
that she would never use.
Yeah. Did I
I can only
believe
go by
that?
what they say.
Yeah, exactly,
You know.
yeah,
Or what I see, and I didn't see it, so.
yeah. Did you find the scoop?
It was a
No.
scoop at the drive-through there, I think it was.
Yeah, I don't
They
think
use
so.
it for the ice machine.
Oh, yeah. Did you use
Everybody
that?
starts
I
the
don't
right
think
way,
so.
there's no other way to do it. You know what I mean? Everybody starts the correct way,
Yeah.
and that's the way you know it, there's just no other way. Thank you, Angelo.
Thank
Yeah.
you, Angela.
Welcome.
I know this was a lot of months, but I was really impressed to see that people are
Responding.
actually calling us with problems that they have.
I'm
with
psyched.
complaints.
Yeah,
And I think it's a good thing. I'm
That's
glad
a
that
great
they,
thing.
they are.
Like I
mean,
say to people, if we don't know about it, there's nothing we can do about it. If you
Right.
give us a call, you don't have to give us your name and the name of your firstborn and stuff like that, just.
No,
you
but I
know.
was amazed. I
Yeah.
think this is maybe because it's 3 months. I don't think I've
Yeah.
seen this many.
So this administrative
Um,
meeting you had with Cedars,
Yes.
they were all good with your recommendations and we didn't slap them with anything there, did we?
That's where we discussed the plan and what we're going forward, what we
Correct.
need
Uh-huh.
from them
Yep.
and what they could do.
So they're meeting your plan's limits, that they're, you said Plan 1, Plan 2, and they're meeting with those. Thank you.
Have you seen any results?
During the reinspection, I did, yes.
Good.
I mean,
The
as far
cleaning,
as-
yes, the cleaning. The only really holdup here now is the pest control contract.
Okay.
But the fact that he still has his old company there, coming
Yep.
weekly, and I've seen
Yep.
the reports.
As long as
As
you're
long as-
satisfied
I
that
am.
they are moving forward
Yeah,
But if the next inspection is,
backwards, then,
yes, then it's gonna be a different story.
yeah.
Have they hired that person yet?
They have, yes.
They have?
It was an in-house person, yes.
Okay. Was he there when you went?
He was not there during the reinspection. He comes in at night to clean.
Okay.
And his deep cleaning is done, I believe, on Mondays and
but
Thursdays.
most people do come in at night to clean, so.
Yeah,
Yeah.
And a
that's
lot
not
of these
unusual.
food
Yeah.
establishments that you see at night are not are not operating during the
Right,
day, you know,
right.
so
Right.
Yeah.
at least they are, that we can, that's a good thing that
No,
we can
well,
check.
that's what I'm saying, I can understand that, but I mean, if he's there on Mondays and Thursdays, you say?
Correct. Yes,
Okay.
Monday, Thursday.
I would suggest that you go there Friday morning and see just how well
Right.
he cleaned.
Right.
And, or
Tuesday
Tuesday morning,
morning, yeah.
and see how
Something
well
like
he
that, yeah.
cleaned, or see how well that person performed.
Sure. Sure.
Just to make sure that they do have, I'm not saying that I don't believe them, but just,
No, you can't say that.
no, I
No, no.
didn't say that, I just hinted it.
Okay.
Okay.
You're up.
All right.
Thank you, Angelo. Good
Thank you,
job.
Angelo.
Appreciate it, thank you.
Busy summer.
Nice job,
Absolutely.
yeah.
I was pleased with the reports, not a lot of incidents.
No.
It's great.
Yeah. People are getting better with the paper towels and they are
They're-
getting better.
Yeah, I just want to say at this point in time, it's got nothing to do with the health, but those wipes that people are using, the ones with the Clorox wipes and anything like that, do not flush them down the toilet. Do not do that, because you're causing the town a huge problem by main drains being plugged up. All of these little wipes say that they're flushable. They are flushable, but they are not disintegratable. And as a result, you end up having a main drain that is plugged with a big massive ball of these wipes, and it's gonna cost you a lot of money. So do not flush them down the toilet. Walk 2 steps more and put them in the basket. All right? That's all.
Great, so our tobacco regulations went into effect technically on Sunday, so inspections are being conducted out there with the retailers. There's still a lot of confusion. I think we had 6 or 7 contact us yesterday about what they can and cannot sell. Like most of our regulations changed, we kind of do softer enforcement at the beginning with the first inspection, make sure they clearly understand. We sent a notification right after the hearing and then a second notification to retailers with images of what was allowed and not allowed, or what was not allowed. So we will do inspections and then we'll follow up at some point with compliance checks.
Who
I
does
think-
all the compliance checks, excuse me? We do?
As we are actually part of a tobacco collaborative, and it's a bunch of communities, and the employee actually works out of Brookline, but she is responsible for doing inspections and compliance checks in all the communities that are included in the collaborative. Paula, she was at the hearing. She is actually conducting them.
She'll let us know if she finds anybody that's not.
Right.
In
So we'll
compliance.
get a report of what she did when she went out.
When does she start and when does she finish? Does she have a time frame that she does all this?
She has already started. I don't know when she's going to finish. I expect it to at least take a week.
Yeah, so may I just ask, everything has to be out of stores, all those, the jewel cabinetry, everything that lights up that says jewel, all that is part of,
Yes. So the only place I can sell jewel or any smoke accessories.
it's an adult vape shop.
Is
it's an
the
adult
adult
li-
only
license.
store.
Okay, so all these things, cases should be out of the stores. Okay, thank you.
But they can't sell flavor in any of them.
No, I know that.
Right, so no flavored in any product.
Right. They can sell a jewel, but it has to be a tobacco only.
The
No,
adult
no.
only store can sell tobacco and non-flavored.
So-
Non-flavored.
Non-flavored. There's no flavored anywhere in
In
the
the town.
Right.
So that the jewel that you buy you can't buy jewel or tobacco like that at all in a convenience store.
Correct.
Only in the adult, yeah.
Which we had one. It should change ownership. Vape Daddy sold, and it's now, I didn't have the name when I wrote the report, but it's Norwood Vape and Smoke.
Ugh.
So they will be selling vape products and tobacco products.
Okay, but that's the only store that we have at present, and
Did One Stop not?
one did not
Quick Stop
continue.
did not convert to adult.
They did not convert.
So we're back down to one, we're no longer two, we're back down to one. Once they leave the town,
Yeah,
that's
but
it, no more
We have another license
permits.
available.
We have 2 adult-only licenses
That's
available.
right.
One's taken, we have 1 available.
Okay.
If, really, it's just a existing tobacco retailer if they convert it. They have to meet all the other requirements and the regulations, like distances for schools and things like that. We have not heard from any other retailers that want to switch.
Are we part of the Cumberland Farms lawsuit?
No, we do not have a Cumberland Farms
Farms in Norwood.
in Norwood.
Oh, okay. So I thought somebody said we did, but I don't.
I know there have been rumors that we are included in that
And I'm
lawsuit,
trying to
and
feel
we're
like,
not.
you know, go to
No,
ride around
no.
and see if we're, but,
No,
No, we don't
a
have one
Cumberland
in
Farm.
so we're not a part of any lawsuit as of this time
No
with our.
lawsuits, no notifications of any pending lawsuits.
That's great.
So like I said, enforcement we will be vigilant with it, but it's a process. And we will continue to go until all products are removed. And then, of course, following up with the compliance checks, which are just as important to make sure that there's not going under 21.
I mean, it's huge. Vaping is huge on the news currently because of all the deaths and, you know, I mean, we even had the president saying that he was gonna ban it nationwide. I'd be interested to see how that works, but,
Well, one of the things we
Yeah.
talked about was, even if the FDA wants to make regulations, for example, they have a regulation actually in place that says they're gonna put graphic images on tobacco cases. It's been 10 years because they've been hung up in court. So they passed the regulation, but then they've been going through the legal process and they haven't actually been able to implement it.
yeah.
But
So
I've been
it-
noticing on TV that they've been getting more and more of those, not advertisements, more
Public service
public service announcements of people that have had their face cut off and they're, you know, talking through a stoma and things like that, that they've become more prevalent in the, you know, in the TV ads and stuff like that,
Well,
so,
there was actually,
well, for a while there,
a
they
news
stopped.
report this
Yeah.
morning on, I think it was CBS, and they interviewed that Dr. Gupta from New York.
Mm-hmm.
And he basically said that there's 2 parts of this problem. One is that how it's affecting children, and that's where the flavor piece is huge because that's what entices the kids to start is the flavor piece
That's
of
the
it.
lure to them.
That's the
That's
lure
right.
for them. It's because it doesn't taste like tobacco, and that's the lure for them. But then the other piece is the adult population that use the flavors to help get off of cigarettes, which, you know, he wasn't a big proponent. He was more a proponent of the health of children than doing away with
The
flavor.
addiction of
all-
nicotine to adults, that's exactly right, yeah.
Right, so, I mean, it's for both for us. I mean, here we saw the numbers ourselves even before we had this open hearing that, the numbers have increased in the middle school even more so than the high school. And that's a health problem. And now that I'm seeing that, now we're starting to see deaths related to this in kids who are 15, 16, 17 years old. Yes, there are adults that have had it too, but, you know, I mean, I don't want to be the town that has a child that dies from vaping flavored products. And because we chose
Didn't do
not
our
to
job,
pass
right.
the regulation. And, you know, we didn't do it purposely to put anybody out of business. I think we did it for the health of the town. And that's how
what
I
we're here
feel.
for. That's what we're
That's
here
what I
for.
feel strongly about is that's why we are
To
so.
preserve the youth of our town.
Right, and they're our up and coming future, so I'd like them to stay around for a little while longer.
Is
Go ahead.
there, are any of the other towns around us doing, I
Yes.
know that some of the other towns, we had a list of all the towns, but hopefully Westwood and Walpole and Dedham and, you know, those towns have done some, you know, are we
Didn't state
surrounded
of New
with
York
other
just do
towns?
They haven't totally banned all
Okay,
flavors yet.
flavors.
Yeah, there
We're
are other
working on
communities
it.
across the country that have done it. I think San Francisco.
Mhm.
A lot of our neighboring communities have either done it or are looking at it. A lot of tobacco policy sort of has grassroots in Massachusetts where a certain number of communities do it and then the state will do it across the whole state.
Yeah.
Walpole actually is in that Cumberland Farms lawsuit. They
Yeah, I thought,
they, like most communities, exempted adult only from the mint and menthol ban. So we, and I think us and Brookline are the only two communities that included adult only facilities in the mint and menthol ban. So we're unique in that way, but most communities are looking at banning flavors in all convenience stores and general retailers.
So 4 years ago, what did we ban? My memory doesn't hold me.
We did all flavors except mint and menthol.
Oh, okay.
That was a result of really Providence being the first one to do that, and they were successful in court with that exemption. And then some communities started to add mint and menthol, and they were successful in court too. So that's again how it sort of happens grassroots. And then once a community is successful in court, other communities can adopt that regulation.
It's a very, very sad and still very new addiction for the youth and in the adults that are using this, that the outcome is not, yet defined. I mean, except death and, some very bad
It's too new.
hazardous lung diseases. I mean, it's,
Imagine what it's gonna do 5 years down the road if
I
it has
just don't
this
understand how it
bad,
can be approved like that.
a reaction in this short a time.
And
What
I'd
it's
like
gonna
to
be
know
like in another 5
the
years.
secondhand smoke, because when you smoke tobacco, as of all the other surveys, secondhand smoke was duly hazardous to your health by being just around it. So I wonder if all this, when you vape, God, the smoke, you could see it on the street. I mean, is that, or is somebody vaping in a room, is that secondhand smoke as bad for you as the regular cigarette smoke?
I think we don't know. A lot of what you
Yeah,
see
it's-
is more vapor than smoke, but we don't know what's in that.
Oh, okay. So they said a lot of the contaminant to vaping, as you read now, because there's so much on it all of a sudden, that when the vape heats up, that cartridge, there's substance in there that they don't know causes metal or something that could cause this problem with your respiratory when that product heats up.
And again, it's not regulated, we don't know what's in there.
Yeah.
And the nicotine levels are very high, and so that's a concern.
No tar, I tell everybody, no tar, just load it with nicotine.
You still have nicotine, which is,
Which is the addictive substance.
yeah.
Did you wanna talk about this?
We can. I just want to.
Go ahead.
Go ahead.
Big change in the dental program. Dr. Stone will be retiring.
Oh, I read that, yeah.
So he has been an amazing partner and ally in our work on oral health. So he sold his practice, and the new dentist is taking on the program also. So as far as operations, nothing will really change, but
Can we send Dr. Stone a letter telling him how much we appreciate him and how much he's done for the town of Norwood? And, I'd really like to send him a letter and thank him for all
Send him
his.
something else besides a letter too.
I know I'd like to
He's
celebrate
been
him
very
in some way.
gracious
He's been
to us.
not only with the kids, our oral health program, but really with the elder dental program also,
Seniors,
which is
yeah.
a regional program. He's been such an advocate and champion of oral health.
If there was some way that we could show our appreciation or
He's
something
truly
like that.
dedicated
Oh,
for
the man
years,
was amazing.
generations.
The hours and the
Yes.
time that he gave, to the community.
Yeah, no, I definitely think we should celebrate him in some way.
Absolutely,
Yes.
Something to do.
absolutely.
Okay, I'll look at doing something.
Yeah. And thank the new dentist for taking on the
Yeah, that's-
responsibility.
She, he, she?
She.
Yeah. So,
Leocakis?
Liakos?
Lacos.
Liakos.
Excuse me.
Lacos.
we appreciate her picking up the baton and carrying it.
And then a whole slew of meetings, if you have any specific questions, I can
No, I
answer
have
them.
a slew.
Yeah, you were at a lot. You were a busy lady this summer too. All right, board's agenda. Anybody have
Thank you,
something?
Sigal. No,
Thank you, Sigal. Yeah.
this is vaping, make sure we, you need us to go into the stores and check. I want it off the shelves.
Oh, the meeting with Nikki Poulin, that went well.
Yes, so
Good.
we had a very productive meeting. So she actually has a master's in public health.
Yes.
She understands prevention, and I'm kind of excited to have that expertise on the community benefits at the hospital.
Where is she
Yeah,
from?
I have it.
South Shore?
She was in the military service and was actually stationed in Japan for a while.
Japan for.
Okay,
Yeah,
her
I
husband's
don't know
not the
where she's
hockey
from.
player, Angelo.
No.
Poolin guy, played for the Bruins.
No.
Oh, yeah. Huh?
He's
Big
a
Pullman.
Marine, I believe.
It's even better.
Yeah. But she's working at Norwood Hospital as the community benefits person, so,
Oh,
yeah, she seems like she's really, gung ho and getting things together, and I guess she did. I didn't get to know a day, so I didn't get to see what the hospital did, but I know she had bags and bags and bags of stuff to give away, things that she was gonna give to the kids and the townspeople, so.
Great.
Well, that's good, yeah, I'm hoping
that's
that
good.
that will work out good. She's working along with, she's only part-time now, and she's working along with, Meredith, is that her name, the other
Yeah, I
girl?
didn't meet the new marketing director, I didn't meet
Yeah.
her, I just met with Nikki.
A lot of enthusiasm there too, so they're looking forward to keeping
That's
up
good.
the community benefits portion of the town. They're not gonna do as many little meetings that, you know, they only got like 6 people from the
Yeah,
town or
that's-
4 people and things like that. Now they're doing bigger things to get it out there and get Norwood Hospital in the,
Yeah, and I hope, more focus on prevention and a lot
Right.
of the similar work that we do out there, that we could partner with the hospital and community benefits on prevention work.
Right, and, and they have a new ENT doctor there that's supposed to be absolutely amazing. I guess he's really done some great work, and so.
Children?
Yeah,
That's wonderful.
and we're fortunate to get him at Norwood Hospital. For a while there, I guess they didn't have anybody that was really good, and this guy's supposed to be really, for the life of me, his name escapes me, but, yeah,
His name is-
so, but, so, anyway.
Scott, how did the meeting with Teresa Stewart go? I'm always concerned about the school kids because they're such a part of our lives here and the Board of
Yeah.
Health.
You can see sort of the long list of things that we can
Yeah, I
partner
mean,
with the
that's
schools
quite a
on.
many things, but,
Teresa's very active in the Minds Matter Coalition.
Okay.
And with her expertise in mental health. So we talked about a whole slew of collaborations. They want to sort of revisit their wellness policies that haven't been looked at in a couple of years. Obviously, the dental program is a huge partnership we have with them. Aubrey sort of briefly mentioned it about bringing the middle school kids to the high school, and how sometimes transportation can be a barrier.
yeah.
And we're sort of exploring that throughout the community, as transportation can be a barrier to a lot of services, and how it can affect your health. Not just getting to appointments, but getting to a grocery store to get healthy foods, or interacting in the community.
This has been such a long, ongoing,
Right.
Have we worked with the transportation department getting the kids from the junior high to the high school?
Yeah, there wasn't quite availability, so actually Aubrey.
Yeah, because their vans are pretty busy at that time, I would think, when the school gets out.
Yeah, and understanding the constraints of budget and stuff, but I think throughout the community, it's an issue, so hoping to kind of take a look at that with, the coastal planning department, and
Because there's a new head there, he's very good, and I'm sure he will work with us. Did you meet with him yet?
No, I've been
Transportation?
working through Teresa,
Oh,
figured
okay.
out kind of a workaround for now as
Okay.
far as transportation.
His name is Al Bishop, he's,
No
Oh, he's-
relation.
No relation. No, is this the Al Bishop from the airport?
it certainly
Yeah.
is, he runs
Oh,
the
my God.
transportation department for the
Oh.
high school, we're lucky to have him.
He is amazing.
Yep.
He is amazing.
And you also see, of course, the interface funding, because as we look to next fiscal year, funding will be an issue for interface. I think we do, we're talking about, I think we've had positive feedback, so I think we will decide to continue it. But understanding, the schools use it a lot, public safety uses it a lot, and, we refer people to it a lot, so trying to develop a funding mechanism is another thing we discussed.
Good. How about the department head retreat? Did you
Yeah,
go somewhere?
We did. We went to residence down at the Cape and had a day of presentations. Actually, if you remember, Bernie Lynch, who did the hiring process, he has a consulting company about government and ethics and leadership, and he came down and did a presentation. So it was very good. It was very informative.
Everybody get the touchy-feely for all the other department heads? Everybody's good?
Nobody was touchy-feely at all. HR was there, so everything was monitored. Yeah, it's a great team building, activity also.
Okay. Good. All right.
Okay.
Yeah.
Thank you, Scott.
Uh,
I'm good with that, I have no question on it.
Did you want me to talk
Transportation?
about this real quick?
Yeah, real quick, I mean, it just, there's a lot of people out there that like to read,
different types of.
different types of books, and I just thought that this would be a great, where it's in the news all the time now, and it's a topical conversation for, small groups of people, especially parents and things like this. This might be a great time to talk about this and talk about, maybe the author would come and, give us, talk about it and where and when if we ever get this situation.
Yeah, so this is a book that actually, we purchased a bunch of them and the library's gonna be showcasing it also.
You got that?
Tell Your Children the Truth About Marijuana, Mental Illness, and Violence. And we encouraging people to read it, to look it up, and we also are fortunate enough to have the author coming to speak to the town and the community on January 9th at 7 p.m. at the high school. We do ask that you can register at impactnord.org under the events page, upcoming events page. But yeah, so the author will be coming. So the more people that read it and hear about it, the better. I think it's a great book talking about the connections between marijuana use and mental health.
Yeah, and I just think that, it's in such the news and violence and all that sort of stuff. So, if you get a chance, does the library have a copy of the town hall?
They will be getting copies.
Okay,
It's available on Amazon or any other book retailer.
okay. The name is Tell Your Children, and it's by Alex Berenson. And it would be something for kids, parents with kids in schools, not that you have a lot of time, but put it in the bathroom, you'll get to read it.
It's a very good read, and I think it's acceptable for younger children to read also. I didn't find it just for an adult read. Did you?
That's a good point. Yeah, I don't think there's anything.
I read it and I found it very informative. Some of it's common sense, but some kids don't have common sense. So I think, I think for that substance of that book, it's a good read for kids. I don't think it's I think it's out there. I mean, you kind of learn about it.
I think it's common sense for us because we kind of talk about it a lot and
Absolutely.
we know the connection. But I think a lot of people don't know this.
Well, you
So
said
I
that,
think it is
yeah.
informative, and they do heavily rely on epidemiological studies and psychological studies that point to the connections.
Yep.
I'm looking forward to reading it.
It's so much to take in. It just is.
Yeah. Well, that's what we're here for, to educate and,
Look and know your kids around you. That's
that's right.
Right, do we need to set up our next meetings and then we can?
Yes, we don't have anything on it.
Nothing?
What do you do with that? It's right behind me.
Excuse me. Let me get my computer.
Oh, my goodness. Yeah, when are we gonna get our computers?
I don't need one.
Didn't we get a note?
Chromebooks, huh?
I thought we talked about that.
Is some of the boards interested in getting tablets?
Well, that's what we were talking about at one point.
Well, obviously, I use mine, so I like it. It's less paper. I mean, I can print out the agenda, but I can go back and forth and read it.
Yeah, if we get tablets, we would give it all to
Chamber.
paper.
Okay.
We can discuss that if the board's interested.
October.
Do we want to stay away from Tuesdays because of your department head meeting? Or-
I like 10 o'clock.
I like 10 o'clock, but I'm
It
just
does,
saying.
I do have to leave the meeting early, miss important announcements. If we could stay away from Tuesday.
Oh, okay.
10:30, I mean, I don't know if,
No, it's up to you. It's up to the board here. Doesn't matter to me. I'm retired now, so I can. I don't have a schedule anymore. At least yet.
Food clinic, October 19th. 7 o'clock? No, 8.
8.
it's 9 to 11 for the
9 to
residents.
11.
We usually show up 8:30 to set up.
Where are we doing on the 19th?
That's the food
I had a
clinic?
wedding
Oh,
in
food
Vermont
clinic,
Norwood
right.
Day. I was gone Friday, Saturday, and Sunday. Just want you to know that's why I didn't offer any services.
9 to 11, right?
Yes.
I put 8:30, Joni puts 9. So she,
Okay, I put 8:30.
thanks, Joe.
Okay.
All right, so the meeting, let's do, I don't think I have any problem with Mondays.
I'm not available the 21st.
Okay. Well, then let's do the 22nd at 10:30.
Okay. Let's see, Masha, 10:30.
Is that
We're
okay?
doing 10:30? Yeah.
Yep.
That give you enough time to say your goodbyes?
You be home by then?
Yes, just,
Okay.
22nd, right?
Yep.
Yep, got it.
Do we want to go up further?
Yeah, let's go out Friday. Always helps.
Yeah, the issue there, the third Monday of every month, I have Coalition for Local Public Health.
Yeah, okay, let's do the 19th at 10:30.
Yeah. So we can do Tuesdays.
I can't do the 19th.
Okay, Joni.
I have to go to the doctor with Joe.
Do you wanna do the 20th?
Yeah.
Is
that's
Wednesday a
fine.
bad day?
No,
Wednesday is good.
Are we sticking with 10:30 for that one, or are we going back to 10?
10 o'clock. Is that okay?
Yeah.
Okay, so we'll keep that one at 10.
Boy, are we flexible now.
And do we wanna make December since we're
Yes.
in here? We might as well.
Tuesday the 17th?
Is it gonna be our luncheon too?
Yeah, we'll make that our luncheon day. Is that a good day for everybody, the 17th?
Yes.
All right, so we'll do that one at 10:30.
That's at 10:30.
Yeah, we can do that 10:30.
Yep.
That'll make it easier to roll into.
Yep.
Okay. Okay, good. That's 3 meetings.
Okay.
I think that's good enough to start with.
2020.
Oh,
Huh?
yeah.
You take us to 2020, I know.
Up this year.
Any other
Not for-
important
like
issues
another
anybody
I
needs
just
to?
wanna read through my notes. Did we go through
Until April.
everything?
I'll get you
Yeah,
a
but I have
nomination.
to get, I have to get
We checked everything off.
Yeah, you'll get nomination papers in December.
I make a motion
We got-
to
we got-
join the meeting?
second.
All in favor?
Aye.
All right.